All signs and symptoms of the second trimester are not bad. And this one is the one that a lot of women look forward to, and I'm right there with you. Hello, moms and dads, or whatever honorary title you hold in the life of this precious child. Welcome back to Nurse Onyi Teaches. My name is Onyi, and today I will be talking about some of the signs and symptoms that accompany the second trimester. I know you are all taking a deep sigh of relief for surviving the first trimester with all that comes with it. And some of you are not yet willing to look as far ahead as the third trimester, knowing that there will be some things that accompany it that may not be so fun. So let's focus. Let's talk about the second trimester. It is called the smooth sailing. Some people call it the honeymoon phase of pregnancy. But honey, that does not mean that there are no signs and symptoms that accompany it. Today we will talk about 6 of them. And we're going to start right now. Symptom number 1, tyolism, also known as excessive spit in your mouth. Experts don't know what causes it exactly, but we do know that it is very annoying for a lot of women. You just walk around with a ton of spit in your mouth, and for lack of better verbiage, that's what it is. It's saliva. A lot of women want to know how to deal with this, so I will help here. One thing you can do is brush your teeth. The more you brush your teeth, the more clean your oral cavity is. You reduce the amount of bacteria that's in your mouth. You flush it out. And then, you're less likely to spit right after you've brushed your teeth. So clean those teeth more frequently. You can also chew on sugar-free gum, or you can get a hard piece of candy and just suck on it. That can help you to actually swallow that spit and reduce the amount of time you gotta, scuttle away to go spit. And then number 3, don't forget to drink water. If you are spitting, that means you are getting rid of water out of your body. And if you are not rehydrating, you are going to end up like a dehydrated raisin. I don't need for my moms to be dry, so drink water, okay? Stay hydrated. Avoid fruit juices. They tend to deposit more sugar on your teeth, and bacteria love sugar, and that's just going to stimulate more spit in your mouth. Drink water. Your baby will thank you for it. Your blood will thank you for it. Your pregnancy will thank you for it. Symptom number 2. Increased vaginal discharge. This is standard throughout all of pregnancy. Your hormones are raging, sis, and there's nothing you can do about it. And then with your hormones raging, your body is also growing a baby that's putting pressure on your vaginal area. So with increased hormonal activity and with increased pressure on your vaginal area, just expect that more cells will be shed to help keep your vaginal area clean. Your body uses this increased discharge as a means to, number 1, clean out the vaginal walls. And it also uses it to remove the excess bacteria and other foreign organisms that want to come and create a station there. Your hormones during pregnancy causes your pH balance to be kind of thrown off. And when your pH balance, which is the normal balance in your vaginal area, is thrown off, then bacteria or yeast or other things that were not welcome there before feel like it's a good time for them to grow. This increase in your vaginal discharge helps to clean all of that out, keeps you free from infection, and helps you chugging along. Now, some women find this very uncomfortable, and it's understandable. It's a very uncomfortable feeling. But as long as it is clear or whitish in color, it's okay. You can wear a panty liner to help keep it from your underwear. Make sure you are wearing breathable underwear so that you are not encouraging these microorganisms or bacteria and things to grow, because enough oxygen is not passing through this area to help keep things in check. Now, if your discharge is ever greenish or yellowish, or it's frothy and kind of like cheese, or it has an odor, or if it is accompanied by any burning or itching sensation, make sure you let your doctor know, because these are signs of infection. Okay? If you ever pee and it has a burning sensation accompanying it, make sure you let your doctor know. These things are not typical in pregnancy. Burning is never a safe symptom in pregnancy. You want to get that checked out as soon as possible. Okay? Symptom number 3, backaches. Now, this one you are going to deal with. Very few fortunate women can ride through the second trimester and not deal with a lot of back pain. But the vast majority, you are carrying life. And as it grows, your center of gravity is going to shift. Now, what that does is as your abdomen pushes forward, your back will sway to try to balance things out. And that's what causes that pain to start, especially in your lower back, around your tailbone area. It's uncomfortable, but there are some things that you can do to manage it. Number 1, you can wear a pregnancy belt. Now, make sure that it is well fitted and that it supports your posture and does not put a lot of pressure on you. You can also do some light stretching activity. The more you stretch, the more those muscles that, support pregnancy get the right amount of oxygen and blood flow to it. And it kind of eases them up, loosens things up, and helps you manage back pain better. If you do those 2 things and it's still not helping, get in touch with your doctor, get in touch with your obstetrician, and they may suggest or, allow you to apply some cold compress to your back area, or, occasionally you can use a warm compress too. What that does is it just kind of eases those pains it eases the pain in the muscle. And there's nothing wrong with that. However, make sure that you never, ever apply any kind of heat to your abdomen. That's where your baby is, and we want your baby's temperature to be kept kind of right. Remember, even during the second trimester, your baby is still growing. So if you introduce any kind of heat or any unfavorable conditions, you can throw off something, and we don't need that. We need a healthy, happy mom and baby. Okay? And then symptom number 4, heartburn. I wish I can tell you that it's not something that a lot of pregnant women deal with, but it is. This one has a hormonal implication. Your body, when you get pregnant, releases progesterone, it releases relaxin, and what these hormones do is slow down your digestive tract so that your body can absorb all these good nutrients that you consume to help feed your growing body and feed your baby's growing body. Unfortunately, the same body that's slowing things down causes your body to regurgitate things, and they come back up into your throat and out your mouth. And that sensation is not fun. It's not fun. I had it when I was pregnant with my children. I can tell you that it burns. There are some things that you can do to help alleviate heartburn. Number 1, you can drink water, you can drink milk. Okay? That can help soothe and coat your tired, achy throat and get that sensation to kind of calm down. Number 2, eat smaller, more frequent meals. The typical 3 meals a day just does not cut it during pregnancy. Number 1, you're going to be hungry a lot more often. So you might as well break your food up into smaller portions. When you eat smaller portions, your body works it out of your stomach a lot faster. And, it goes through the intestinal tract. It just doesn't leave a whole bunch of food sitting there in your stomach, collecting acid, and then you belch and honey fire comes up your throat, out your mouth. Okay? You can also do some light exercise. Believe it or not, exercise really does get your abdominal tract, your abdominal intestines going. And as they work the food across, you can rest assured that you're not dealing with that increased delay in digestion. Okay? On the heels of heartburn comes symptom number 5, which is constipation. Constipation, like heartburn, is also hormone influenced. The same hormones that slow down food in your digestive tract slow it down as it is exiting your bowels. And the longer it stays in your bowel, the more fluid gets pulled out of it. If you didn't know, the one job that your large intestine can do very well is pull water out of your poop. Okay? And if you are not getting that poop out as quick as you get that sensation, or maybe you're not even getting the sensation, then honey, when you go to the bathroom, you are going to feel like you are practicing labor and delivery. You don't want to deal with that. So here's what you do to help alleviate constipation. Drink more water. You will hear your doctors, your nurses, Nurse Onyi tell you that water comes to the rescue. If you drink enough water, it helps to soften those stools so that when you go to the bathroom, you're not having to hold on to promises and pray through a bowel movement. Number 2, you can eat foods that are high in fiber. Fiber is a known assistant to healthy bowel movement activity. You can also increase the number of fruits and vegetables that you eat, okay? And then, believe it or not, exercise does help if you need to get things going. So don't just sit around and you are pregnant. Yes, that is understood. But get up and stretch, get up and move. That kind of encourages your bowels to get things flowing and get that poop out of there so that you are not having a poop baby. All right? And then number 6, all signs and symptoms of the second trimester are not bad. And this one is the one that a lot of women look forward to, and I'm right there with you. It's called quickening. Quickening is that first little flutter or sensation of your baby moving. I don't care if it's your first child or your 20th child. There is something exciting about feeling this new life move in you for the first time. If you are a first-time mom, there is a chance that you will feel it right between weeks 16 and week 20. But if you are a mom who has had babies before, you know what's going on, girl. You may feel it a lot sooner than week 16. I felt my 4th child at week 13 moving. I was like, oh my God. So yes, you can feel it a lot sooner than week 16. And then if you are, you may fall in a category of women whose babies just kind of chill. They just hang out. It may take a little longer. You may trend into week 22, sometimes up to week 25 before you feel your baby move, okay? You have heard stories of moms who didn't even know they were pregnant. That one I can't attest to because babies move, but they may delay their movement for a while. If you are ever concerned that your baby is not moving and you are advancing in your second trimester, talk to your doctor. I've heard some women say, drink a cup of cold water. It worked for me and mine. When I wanted them to move and they weren't moving enough, grab a glass of cold water and drink it. Some people will just drink. Anything that gets your digestive tract moving will kind of bother the baby a little bit, and then you may feel a sensation. But quickening is such a little movement that it may even feel like a gas bubble. And you're like, is that baby? Is that gas? Don't worry. Eventually, you're going to know whether it's baby or whether it's gas, because those little flutter movements turn into jabs. And we'll talk about that when you get into your 3rd trimester. If you are ever concerned that what you feel is not enough, or you don't know whether you're feeling anything at all, talk to your obstetrician. They can use a little fetoscope and just listen to your belly, and hearing your child's heartbeat sometimes can be reassuring. But know this, mom, quickening will happen. So don't get discouraged. Hang in there. Enjoy the process. And before you know it, the second trimester will phase out and you will move into the 3rd one. Until the next time, I wish you all a safe, healthy, and happy pregnancy. If you have not already, go ahead and hit the subscribe button. Hit the like if you appreciate it or learned something from this video. Share it with somebody you know can benefit from it. And then leave me some comments in the comment area. I love to interact with you all. We're family. You are my community. And we are here to learn and share together. Be blessed, you guys, until the next time.